Welcome to In the Cool of the Day and today's segment of People Connecting People. I'm your host, Ruth Pegeron, and I have a special show for you today. My guest is a healthcare professional with a genuine passion for advocacy. She spent 19 years in youth advocacy, helping underserved communities bridge the gap between home and school. Her personal experience with family struggles related to dementia inspired her to support others facing similar elder care challenges. She is dedicated to educating her clients about the available resources, services, and strategies to manage caregiving challenges. Over the years, she has counseled numerous families in home care and senior living. She currently oversees services across Virginia, Maryland, Washington, D.C., and Delaware. So please welcome Director of Strategic Partnerships in the Continuum of Care with Capital City Nurses, Delores Clearfield. Welcome. Thank you for being here.
Thank you for having me. I'm honored.
Wow, you do a lot. You do a lot of give back.
We do. We do a lot to serve the community.
Yes, yes. And I'm just honored to hear more about it and for our audience to hear more about it. But before that, let's just hear a little bit about you. So can you just tell us a little bit about, in our audience, a little bit about Delores?
Sure. So, well, in the youth advocacy role, I kind of started helping families through personal struggles and working with different socioeconomic makeup and kind of trying to meet people where they were to provide the resources. And as my journey continued, I had family members that were starting to navigate the healthcare continuum. And on the opposite end of the spectrum, it felt like there was exactly the same thing. There's a lot of ideas, there's a lot of programs, there's a lot of initiatives, but there was nobody helping. And so when I came to this end of the spectrum, I kind of just said, hey, I can do this, right? I know. I always tell our families that I work with, I'm not the one that goes away, I just get louder.
I like that.
And so
who was your family struggled? You said you went through some of the
we had quite a few, but primarily my papa was the first. And dementia was not friendly to him. And he was not an accepting person, and I come from a long line of strong individuals, so we are very much the type of get off me, I got it.
I can do
which
this.
made it a little more challenging. So we just started trying to find tips, strategies, tools, resources.
For that personality type with with this now new diagnosis, right.
So, and going through that, kind of fell in love with, my mom was a nurse, and we used to spend our Saturdays at yard sales working and looking for polyester pants for ladies that were in a skilled nursing facility she ran into that just wanted something of their own, some kind of doily that they wanted to decorate, you know, their space with, and understanding the identity and the passion and the empathy. That they're desperately longing for, and kind of seeing that, and then wanting to be able to provide just simple things. So my husband and I started a nonprofit, wanting to collect used durable medical equipment and repurpose it back to the community that couldn't afford it, or was struggling with the healthcare system and the timeline that it takes. If someone cannot get from point A to point B independently, they don't have 6, 8, 12 weeks for Medicare or Medicaid to make a decision. Right? I'm going home from the hospital tomorrow, but don't worry, we'll get that process for you. You'll get your bed in 3 months. You know, it just,
I need it yesterday. I need it when I get there.
So, and while we continue to fund programs and do all of these things, the timelines, they just don't equate to success. Right? And outcomes that help people continue to thrive independently.
And
you know,
motivate them along the way.
And 100%. What you have to do, you should do something that gives you that head and heart alignment, right? Because that's the driving force behind what it is that we do every day. And my husband, we combined have 7 children, and he told me I could not collect any more of those. So I had to direct my energy somewhere else.
Wow, what a great story. And those energies at Capital City Nursing.
Yes.
Yeah, so what does Capital City Nursing do in total?
Oh, a lot.
A lot, yeah.
So Capital City Nurses is part of our family of brands. Care Advantage is our parent company, based out of Richmond. And so we provide private duty in-home caregivers, and then private duty nurses for those that have ongoing skilled needs that they can't manage on their own in their home. Medicare gives allowances for skilled services for only so long, and they hope that someone can self-manage or a family member can be educated on performing the duties, and for a lot of families they can't. And on the personal care side, we see a lot of families that are not aware that someone's coming or can be there to help with their care. There's a lot of visiting services under Medicare, and we have the impression sometimes, I'm getting physical and occupational therapy, so we're good, we don't need anything else. And then they realize they're there for 45-minute visits, and there's 24 hours in a day. So how do we do this? You know, how do we manage? So we provide care across Virginia, Maryland, DC, Delaware. We work with pretty much the entire makeup of families.
So you kind of come alongside of that 45-minute person and you add more.
Right. And we meet them where they are. You know, every family has different needs on schedules, capabilities, and we're very clinically heavy in the fact that we have RN clinical directors that follow the families and go in and do assessments, because we have a picture in our mind of what good looks like. And then when we get in the midst of it, that may change. So the support services and having a nurse come in and see an environment and just say, hey, you know what, this may not be the best room for you when you get home, right? And this, you may need to add a piece of equipment to keep you safe. And then working along the Medicare side with Medicare partners to complete their care planning so that they have a successful outcome. Everybody wins.
Everybody wins.
Everybody wins.
So what do you hear most from families in those kind of situations, especially when they're coming home and they do have to make some adjustments? You know, they've lived in a home for 40 years, 38 years, they have their favorite room, and now we're talking to them about maybe realigning their home to keep them in their home, obviously. What do you find
most commonly? Resistance or denial. I don't know a person alive that wants someone else, especially a stranger, coming into my home to tell me how to reinvent the wheel. Right. And so when we leave a hospital setting, a lot of the times, and that's when the what if happens, we end up in the hospital and there's someone there at the push of a button. And somebody brings us our meals. Somebody comes in if we need to get up and go to the restroom to help us. And those are all things that we continue to gradually just kind of accept as a norm, but don't realize that when you get home, they're not there.
They're not there.
Right? And so our mindset is, I've got it. And my capabilities are at this point because I am getting up and going to the bathroom. I'm eating my meals independently. I am taking my medications the way I'm supposed to. I'm drinking my water. Well, when the only focus you have is someone bringing you the water, reminding you to drink it, preparing and bringing you the meals so that you can eat, being there to get you safely from point A to point B in case there is a fall. They may not need to touch you, but they're there in the event that you need them. And knowing that if the oh my gosh happens, I can push a button and they come. And when you go home, that's not the case. The environment is not conducive. We typically don't have a hospital bed. If we've been hospitalized for a while, where are the groceries coming from? Are the things that are in the refrigerator still good? How do I get up and I prepare that meal? When I get into my bathroom at home, there are no bars. There is no space to move this new piece of equipment that they gave me. I need to get into the shower, but I can't walk into it. I now have to step over a tub. How do we navigate those things? And for a lot of families, they don't know because they've never been in that situation. And unfortunately, it's not until they get home that we realize this. And when crisis happens, as a family, we rally around our loved ones. But as life settles back into a norm and we get home, we still have our obligations, our families, our jobs, our children. And while you want to be there for somebody, is it always possible?
To be there.
And then we start saying, well, you know, she had a really good day. I think we'll be okay. We'll be back in the morning.
Right. And everybody's goal is to get out the hospital.
Oh, yeah.
Yeah, like
100%.
everybody's goal is to get over that, is get out the hospital.
Regardless of the reason you're there, I don't know anybody that prefers to stay.
Right. It's motivating. And then you go home and you
Yes.
don't want to go back. So you help overcome some of those barriers?
We do. We have
Capital Center?
conversations, right, with families, kind of about what good looks like. We make a lot of suggestions, recommendations. We work with a lot of families to kind of come to a realization of where someone is, and to help them be proactive in their planning versus reactive. Because unfortunately, we see a lot of families that are resistant, are afraid, or think they're going to get locked into something. I've got it, I don't need it. And then the next call we get from them is 100% reactive. We need you right now. Something's happened.
Okay.
And that is just, it's kind of like hearing, I wish I had known sooner. And you just kind of stop and say, please let me help you.
So how do you help them with the continuum of care? Or what is the continuum of care? Maybe just give us a little bit of a definition.
Continuum of care is basically there within your journey. We illustrate it to families like a tandem bike, understanding that on the personal care side, we provide all the activities of daily living, the bathing, the transferring, the dressing, the meals, the med reminders. But on the other side, there are your Medicare covered services, your physical therapy, occupational, palliative care, hospice care, durable medical equipment, delivery pharmacies, all of the services. And it takes both working in collaboration to keep people moving forward with confidence. So within the continuum, there's so many facets that we have, including like our advanced care planning. If I am in the middle of a what if, and I don't have my advanced care planning, who's speaking for me?
Right.
Who's making decisions for me? Is long-term care going to talk to my adult daughter about starting a policy because they don't have a signed release? So we talk through the continuum of care and utilizing our RN clinical directors when they go in and they do an assessment for a family that's starting services. We ask questions. Food insecurity, transportation, family supports. If you're doing a physical assessment for someone and you see that they're furniture walking, we can make a recommendation for physical therapy. We can help them kind of understand that working collectively together, you're going to maintain your independence for as long as possible, because ultimately the goal for everyone is to be in the least restrictive environment in the most cost-effective way. Right. And a lot of the times when you go back to that hospital discharge, we hear hospitals or skilled nursing say 24/7. You need 24/7
care. Yeah, you hear that a lot. 24/7. Yeah.
And for a lot of them, they may need somebody in the event of a what if, right? But they need support services. They need to help to get back to baseline. They need to understand how to utilize all of the continuum to reach their ultimate goal versus just pocketing for certain areas.
So when you do that, do you talk with you've said the word families a lot, which is really nice to hear, instead of just the patient. Right. The patient. So when you do, is that a strategy at Capital Nurses, is to ask, can the daughter be there, the son be there, the whoever is a part of their caregiving circle?
Yes.
Is that encouraged as well, to have those, to understand the continuum of care?
Yes, a lot of the times we deal directly with the person receiving the care independently, because there are quite a few solo agers out there.
Yes,
we're coming across more and more. But if we can collectively work with family, like who is the alternative? Who am I going to call in the event of an emergency? Those are the people that we talk with, because it's kind of like when someone has started having cognitive impairment and we take a loved one to the doctors, and the patient comes in, she sits down, her legs are crossed, her purse is on her shoulder, her makeup and her hair are set, and he's like, how are we? And she's like, I'm good.
Good, right.
And there's a family member behind them going,
son, no.
Yeah, we're not good, right? And it's never ill-intended, but sometimes we don't realize where we are. And like I said, that picture of what good looked like in a hospital may look different at home. What a spouse or an adult child's picture of good may look like may drive the actual person that's receiving care crazy, because we ask about personalities, right? And how do I put somebody with you that you're going to respond to? Because if you don't like me, you're not going to let me help you.
Wow, got it. Wow, that was well answered. Thank you so much for that.
You're welcome.
Well, it's time for a short break. So it's time for a short break. We will return after these important messages.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Welcome back. You are watching In the Cool of the Day in today's segment of People Connecting People with my special guest, Delores Clearfield, Director of Strategic Partnerships in the Continuum of Care with Capital City Nurses. Now, prior to the break, we were talking, and you answered the question so perfectly of how you work with families, which is great, and who's a part of those conversations. But it sounds like you have a really big network and you do a lot of big things. So tell me a little bit about the strategic partnerships, especially that's in your title as well. Like, how does that work, or who do you strategically partner with?
Strategic partnerships for us are, we hold them in high regard because those are the people that we are connecting our families with to say, hey, they can help you as part of this journey. And they are our partners in ensuring outcomes for those families. So we work with home health companies, delivery pharmacies, medical equipment companies, hospice, palliative services, aging life care managers, financial advisors, daily money managers, dog walkers, mobile stylists, mobile podiatry, home modification companies. And, we basically, through those alliances with those companies, we know that not only are they going to treat our families the same way that we would, but they're going to execute, right? And the beautiful thing about what we do in people serving people is we get to have transparent conversations around there's no such thing as perfection. And there's no such thing as a person who just says, sure, do whatever you think is right. So there's a lot of education and choosing partners that can sit down with a family, with a patient and say, hey, this is what we do, and this is how it works, and this is how it will help. And I want to thank you for trusting us. And I think a lot of the times going through strategic partnerships, people assume because I do this and you do this, we should work together. And I think it's more about because we do this and because you do that, we can ensure a better outcome. So how do we gain the family's trust to allow us to help them? And that is where kind of we pick up and we run with that, and we can be a solution. I always tell the families, I'm not a care manager. I'm your fire extinguisher, right? I'm going to put out the immediate fire that comes in that our clinical teams have identified. We're going to pull in the people that they need because everybody wants to choose where home is. And without a lot of these interventions, some of them wouldn't be able to stay in their homes. And they wouldn't be able or return to the home that they've loved. And for some of them, that may be exactly what it takes for them to see that home's probably not here anymore. And so we work with independent living, assisted living, memory care communities, continued care retirement communities, placement specialists that help families guide. We work with funeral homes. We work with a lot of elder law attorneys for advanced care planning, neuro and neuropsychologists for diagnosis. A lot of the medical field is very aware of what it is that we do, because anymore when you call a healthcare system, you're getting teleprompted. Right, for a lot of things. And when you get someone, it's not the person that can answer your question. And if there's a little tiny piece of cognitive impairment for that patient, frustration kicks in. They may not be able to easily articulate what it is that they need. We get into a doctor's appointment and you have a 15-minute window, and it's like, by the time I sat down, you took my blood pressure and I got my bearings to remember my questions. He's like, okay, anything else? Thank you for coming.
Exactly.
And they're leaving and the patient's like,
what just happened?
And again, no ill intent on anyone's part. It's just the way that we are, and we don't have enough geriatricians, and so everybody's kind of trying to do the best that they can. So that continuum of care is that wrap around to say, hey, we've got you.
Mm-hmm.
You know, thank you for trusting us. Allow us the opportunity now to help fix this for you.
Right. Wow,
And it works beautifully.
It does. It sounds like it, because every person has different needs.
Right.
So, you know, this person may have the dog walker, but not the money manager.
Right.
This person may have, you know, the bars up at home in the bathroom because somebody put them up, but maybe they need a little bit more access in the kitchen. So you do need, everybody's needs are very different. But the basic is, I got you.
Yeah.
We got you.
And
the fire extinguisher, I love that. Yeah. Let's put that fire out right now. And sometimes I find that professionals like yourself, they can see the fire just based on your experience before it's even lit, where, you know, someone like
right
me,
now it's just smoldering.
It's just smoldering. We might not even see it, right? But you
Yeah.
know it's coming, which is great. So how do families pay for like these kind of services and get the help that they need paid for? How do they do that?
So to have personal care, private duty aid come into the home, Medicare has not caught up with that need. They tried a couple of years ago to do what they called personal home helper waivers, and it only allowed families 4 hours for up to 31 dates of service a year. And they made it a special enrollment for most of those managed cares. And if you didn't enroll, you didn't receive it.
Okay.
And then they couldn't find companies that could fulfill it. So it kind of just fell to the wayside. And so primarily, we have the ability to accept Medicaid long-term care waivers, right? CCC plus waivers. Medicaid will pay for personal care for families that have a need, but Medicaid requires financial indigency. So a lot of families are confused when you say, do you have Medicare or Medicaid or both? And Medicaid is those that are disabled, don't necessarily have to be 65 to be both Medicare and Medicaid enrolled. So Medicaid waivers will cover, there are veteran benefits and programs that cover the cost of personal care. There's long-term care insurance policies that people purchased years ago. I always warn my families, the second the crisis happens, call long-term care, because most will have a 90-day elimination period, meaning they have to pay out of pocket before the policy will kick in.
After 90 days.
Right. And then traditionally private pay. So families choose credit cards, they use auto drafts from their bank accounts, but personal care itself, unfortunately, no Medicare.
No Medicare.
No Medicare.
So there are other ways that people get the services and get the help through other insurance venues, and long-term care is a very important one.
Yes, and we have spent a lot of time kind of finiting some of these programs. We take grants from Alzheimer's Foundation, Parkinson's Foundations. We work with Area Agency on Aging, sometimes have RFPs where they provide care. It's basically an agreement they work out with community-based programs through grants to cover that middle of the road. So I worked my whole life. I paid off my home. I'm not financially indigent, but I don't have any ancillary income for a what if.
Right.
So
I need the money I have to care for me daily.
Right, exactly.
So this extra is like gap insurance a little bit.
Kind of, yes. And so you can apply through the county, and every county has different programs. But one of the things that we wanted to do is we dedicated to serving ourselves to serving the entire socioeconomic makeup, is we started caregiving as in our roots. So for those families that have Medicaid waivers, but again, maybe are not so comfortable with me coming in as a stranger, but I haven't been able to work because I've been taking care of my mom, my wife, my husband for the last year. We can certify those family caregivers, make them an employee, and actually pay them to provide the care.
Oh wow, that's wonderful.
So we want to keep that family bond strong, right? We want to enable the connections, but we also want to allow someone to have the ability to have a W-2.
Yes.
To have benefits, to have respite backup, to have on-site clinical oversight of an RN in the home, a registered nurse. And that continuum of care support, which has been so vital for the outcome and success of so many families we've worked with.
Yes, that's very important, because the caregiver needs support too.
Yes,
and support
100%.
Can be financial. And I know sometimes people are like, I don't want to be paid for helping my mom. That's what I'm supposed to do. But it's not just that. It's also, you deserve it. There's a program to give it to you. And caregiving is a job. I always tell people, when I was caregiving for my mother, it was the best job I ever had. It was hard.
Yeah.
But it was honorable, and you walk away from it saying, that was the best job I ever had.
Mm-hmm.
And it was very rewarding. But to not have a financial backlash from it, I would have, appreciated too, to be able to be paid for that.
Right.
And to have that program and educate people on that is supporting them. It's not trying to demean what they're supposed to do in their family culture.
Well, and that goes back to what you first asked me about the
Mm-hmm.
resistance of families
Right,
and their why.
Right.
Denial of where we are is a huge one, but guilt.
Guilt. Yeah.
The association of, this is my spouse, this is my family member, this is my
duty.
Mom.
Yeah,
I
right.
should be doing this.
Right.
And a lot of the times what we don't realize is that there's so much encompassed in caregiving
Mm-hmm.
as a whole. If we don't watch, it flips the dynamic of the relationship, and
Mm-hmm.
it makes it about care and not about the person.
Right.
But we don't want to take our hands off, because I'm letting you down at that point. I'm
Mm-hmm.
neglecting my duties.
Right.
And so with the Family Caregiver Program, it's enabled us to empower those families to be able to say, I need a break. I love you.
Mm-hmm.
And today I just want you to be my mom, and I'm just going to be your daughter.
Mm-hmm.
Right. And it's not even all the family caregiver. We have other families that are not a family caregiver that utilize our caregivers, just because I need to have that moment, one, to kind of bring myself back to where I am. Because with my own mother, my mother's a retired nurse. She took care of my grandmother, and she would have days where she's like, I love her, but I'm going to kill her.
Right, exactly.
And I'm like, Mom, you don't mean that. She's like, no, I do. I don't. I don't.
I just need a break. That's
but
her
if
way
somebody
of saying
else
I need
said,
a break.
I'll come and I'll take her for the weekend, right? And I'll be there to help you. I've got it. And sometimes we are our own worst enemies. And so we want to allow dynamics to be what they are within a family and maintain that relationship. And nobody wants to look back on their days and say, you're not going to say, I made sure her sheets were clean. I made sure she was fed. I made sure, that she got her medication on time. Families say, man, I hope she knows how much I loved her.
Yep.
How much
exactly
I miss her.
Do
you remember when she used to?
Yep.
And
that's what's important.
I love the fact that we get to do that for people every day.
You do.
Right. So.
Well, I think I know it was, but we're going to wrap it up now. So I like to leave the last 10 seconds for anything you think our audience should know about just getting the support they need or help they need, or anything our audience you can share with them.
You want to make sure that you're working with a licensed and bonded agency that is only utilizing certified caregivers for everyone's protection.
Okay. Thank you. That was good advice. Thank you so much for that.
You're welcome.
Yes. Well, it's that time again. If you have any questions about today's segment, please see the information scrolling below. You have been watching In the Cool of the Day and today's segment of People Connecting People. Thanks for watching. Until next time, bye-bye.